We're the Hidradenitis Suppuradivas. If you've got HS, you'll want to meet us. It's not your fault, put the shame to a halt. HS divas know how to have a ball. The Hidradenitis Suppuradivas.
I know treatment can be such a hard discussion depending on where you're at in your HS journey, what you already know and what you need to know about treatment. And I feel like this is really something I'm excited to touch on because I just got on my first HS treatment a few months ago. So I'm super fresh, but I was just like you guys. I remember having so many questions, feeling a lot of mistrust in the medical community, feeling unsupported in my HS journey. And it took a lot of courage to go back to the dermatologist and hope that they even knew what HS was and then be ready to make that decision for treatment. And so there are different treatment options out there. There's not just prescription, and there's different ways to treat your HS. Like I said, without just a prescription, but what we can do at home and like wound care after surgery and things like that. So we're going to dive into that. And we are here with Brinley Brooks. She's the executive director of HS Connect and my co-host. And she also has had HS treatment. So what have you had in your journey?
So I think first of all, let's start with your derm makes a huge difference here.
Absolutely.
So finding the right dermatologist is like finding a needle in a haystack when it comes to HS. If you are seeking an HS expert as a dermatologist, I would highly recommend checking out our list, our dermatologist finder, and also, the HS Foundation has a dermatologist finder as well. So I would highly recommend checking out both of those places. The difference between our two lists are that we also take patient recommendations for our list, but that's the best place to start to find a derm who treats HS and is knowledgeable in HS. The hope is that as I don't know how to say this properly, but as HS grows in popularity, because there are so many people who have it, that there will be so many more derms who know and understand HS and know how to treat HS appropriately. Right now, it's like kissing a lot of frogs to find a prince in some cases. So the best place to start is those derm finders. And then as far as treatment goes, there's a lot of insurance that plays a role in this too. So everyone's story with what that journey looks like is a little bit different. Mm-hmm. So your insurance plays a large part in what your HS journey looks like treatment-wise as well. So I know, in a lot of cases, people want to move to what they can do that's the most advanced, but sometimes there's a barrier with insurance being able to do that. So a lot of times when you start on your HS journey, you will be put on antibiotics is usually the first line of defense. And moving from there, that's, it's typically a requirement in order to move to the next stage of therapy for HS. And a lot of times you have to go through multiple antibiotics in order to move to the next stage. A lot of times they create GI upset. You are given the prescription, and the prescription for antibiotics does not come because we have an infection. We're given those antibiotics because of their inflammatory properties. So they tamp down the inflammation in our body. It has nothing to do with HS or being infectious. HS is not an infectious disease. So just make sure that there's an understanding on that and why they're given to us, because that's a huge misconception. And then through that process, you are given these antibiotics. Whether you choose to take them or not is up to you as a patient. So yeah, wink. So a lot of times people will choose not to take those antibiotics because of the GI upset and things that can happen as side effects of those.
Because that is like for real. I remember getting antibiotics in my journey with HS when I was like, just time is all runs back, but it's like way back. And it's like they used to give me a yeast infection. Mm-hmm. And then I used to feel extra gross and dirty. So I would not want to use them.
Yeah. And again, you can be prescribed them, you can pick them up from the pharmacy. That whether you actually take them or not is completely up to you as a patient. Unfortunately, because of a lot of times, like I said, step therapy, there has to be an attempt at antibiotics without them working to move to the next step. So however you choose to interpret that information is completely up to you. And then we do have, in the world of biologics, which I know there's a lot of fear about taking biologic medication for HS, but there are new biologics on the market. So, for a long time, there was only one. And now there are 2 additional FDA-approved biologics. So we right now have a total of 3. Earlier last year, we started out, 2023, we had 1. And then in end of 2023 and 2024, we had 2 additions. That's a huge win for the HS community.
Right.
I mean, being able to fail a biologic, not a great thing, but knowing that that's not the only one
option
that you can try is something that we should really celebrate.
Yeah.
And as they're coming to market, they're getting better and better. So this is really exciting for the HS community to have.
Right.
So tell me some of the concerns that you've heard from, people who follow you about their concerns about being on a biologic treatment.
So I think when it comes to the biologic, there's the needles. There's always going to be that in any, diagnosed thing. People don't like to deal with needles.
Yes.
Commonly known. So, I mean, there's that. And I think I tapered with that at the first time I did my biologic injection. I was like, okay, Josh, you got this. But after that, it was pretty easy for me. Also, my niece is a type 1 diabetic and she has to get poked pretty often. I'm like, if she could do it, I could do it, So it was an inspiring thing. And I understand that it's just something that I would hate to tell you that you're just going to have to get over it. But if that's something that you are seeking in your HS journey to try a biologic, that's the only way you could take it, boo-boo. So it's just but preparing yourself before you get in that space, okay, you do have to, I take my medication out 30 minutes before, so it can kind of come to room temperature. So in that 30 minutes, go do some self-care a little bit, prepare yourself to be a little bit at ease because you're going to be a little vamped up about it. I think people, especially the Black community, they feel like they don't have that trust. They don't want to be guinea piggish. There's not enough information. I'm scared of the side effects. So I think they're just common questions and fears that I think anybody would have, but they're more cautious because they know HS is not as far as it should be in the medical. So they're like, I don't trust it. You know what I mean? So I think just seeing more people get informed about the process is enough, because that's basically what you did for me. I was like, hey, listen, I'm really scared about all of these weird side effects. But when you broke down the process to me about a trial and how it all is, how they have to list if somebody is taking a medication in the trial and they get a cough, even if it's not per se the drug giving them that cough, they have to list that. And I think that kind of just, I was like, it's not always what it's pictured to be.
Yes. And
even though side effects are serious and we should take them into consideration, you also explained it to me in a different light that changed my perception of what if it doesn't work? But what if it does? And it was just oh, I should take that chance on myself. So it's just a process.
I think that there's also something that we don't talk about in the community, which is that there's a risk of not being on a treatment. So choosing not to treat your HS and letting it run rampant is also an inherent risk.
Yeah.
So I think no matter which way you go, there's a risk involved in it. There's a lot of other medications that they do try as well. If you know that your HS is hormonal, birth control is a great option because that can really start helping.
Yeah.
Spironolactone is another great option that they usually use if it's a hormonal type HS. So there's a lot of other tools that the doctors have in their toolkits, and if they're well versed in HS, they will pull those things out. The other thing I think that's important to know is that they don't typically try multiple treatments at the same time as far as starting new treatments.
Yeah.
So for instance, we'll use Caitlin as an example. So we're changing, she's currently on Cosentyx. It's helping, but not as much as we would hope. So we're switching to the every other week dose instead of the monthly. And there was also discussion about ramping up her spironolactone. But we're not doing both of those things at the same time, because how would we know what worked? Yeah. So we're going to change the Cosentyx dosage and frequency, and then see how that goes for a couple of months. Then potentially add in the spironolactone and increase the spironolactone if we don't see the response that we're looking for. So I think the other hard thing with HS too is that with every treatment that we try, we have to give it a couple months.
Yeah.
And I think, for somebody like a derm to tell you like, okay, we got to give this a couple months, you're living with it every day. That's a really long time. But unfortunately, in a lot of cases, we don't know what's going to work until we give it some time.
And sometimes it's hard for us to even like recall when you're in the thick of like dealing with multiple flares at a time. Your pain is almost never non-existent. Like, yeah, it's hard to see the light at the end of the tunnel, but that's why we're explaining it's really important to have some way to track it all. And like now we have the Papaya app, but like even if you don't want to do all of those things, because sometimes we just don't like to do simple things, but make it simpler. Get a journal and get a pen and paper, and say, hey, this is how many flares I have today. This is what I'm dealing with. Like, because we literally sometimes just cannot remember. Hey, yeah, 7 days ago, this flare was excruciating, but today it's less excruciating. Like, we 9 times out of 10 aren't going to remember that when we're dealing with multiple at the same time, and it's just chaotic. So It's like, find a way to track. That way you have solid evidence, and that's why the Papaya app is honestly so genius, because you can get very, very detailed there, and then you can even print it out and take it with you to your doctor, so it's like hardcore evidence. So if you're on a treatment option already, you're able to take that to them and say, hey, well, it has gotten better. I didn't even realize it. Or like, it's progressively been getting worse and I didn't even realize it. Like, we just got to do a little bit better care of taking inventory of what's really going on with our body and listening.
And I think that's so especially important when you're starting a new treatment, because we do have what's called recall bias, and typically it's about the last 5 to 7 days is all you can remember. You can't remember beyond that, because our brains are too full of other things. So having something like the Papaya app where you can track what's going on with you, we helped design that app, and it's, we really pushed the envelope with it of asking them what they could do. So we asked them to create a body map where you could just drop a pin on where your flares are. Nobody wants to write in there, it's in my inguinal fold, or things like that. So, and then each of those flares, you can identify what kinds of symptoms you're having with it, what the drainage is. So it's a really great way to do that. And then you, like you said, you can print it out, you can email it straight from there to your doctor, you can ask it to run a report for a specific amount of time. It's a fantastic way to do that.
Genius.
Yes. So, and you can find it in Google Play or the App Store, by the way. Papaya by Genevieve, Genevive. And it was created by 2 HS experts, Vivian Shi and Jen Shao, both of whom I absolutely love. And I would so highly recommend checking that out. And then back to what you were talking about with the biologics. So when it comes to drugs like adalimumab or Humira, they had black box warning labels, which means there was serious potential side effects. The new medications do not have those same serious side effect warnings. They do not have black box label warnings. So it's important to note that, because we're getting safer medications available. That doesn't mean there aren't any side effects. It just means the side effects are less worrisome, I think, for the general public. The other important thing to keep in mind about these side effects that are mentioned, it's for the entire population who participated in the trial, which is not just HS patients in a lot of these trials. So Humira is used in a lot of indications, including rheumatoid arthritis, which typically comes from an older population. So when you're thinking about what those side effects are, You have to keep some of that in mind.
Yeah.
It's one of the things I would love to see in the future, and I keep mentioning this to every pharma company I have the opportunity to. Extrapolate your data. Pull out what the HS population's risks are specifically. Don't lump us in with everybody else. Pull out by disease state what your risks are so that we can make better informed decisions. So, and we're working on putting together a one-pager that compares all 3 of the FDA-approved medications now for HS. And what their risks are, their benefits, what their clinical trial studies showed as far as success rates, and all of that information, so that as a patient, it's in one spot that you can look through it and make an informed decision for yourself.
Yeah, because we know that a confused mind says no.
Yes.
So when you are super confused, you don't know what these words mean, and the ones you do understand sound scary, you're like, I think I'd rather just take my chances seeing if this gets worse or seeing if I can clear it up on my own, because let's face it, some of you don't even have a diagnosis. So how would you know that you even need medication? And then to get into the dermatologist and you get told that, okay, well, this girl's talking about her taking an injection online, but why do I have to start with an antibiotic? But it's just the way that it is right now, and it's probably the way that it's going to be. But like, I rather you start, and what if an antibiotic knocks that out for you and like it clears it and it helps, and if it doesn't, then there are more options, and I think that's the best thing. So I have 2 questions for you, Brinley, just because I know that like you've lived through one of them and I know you can maybe answer the other one for me. But the first one is surgery as a treatment option. So when do you think it's time to realistically start considering surgery?
I'm a huge proponent of surgery because surgery is what's worked for me. But I've also seen surgical procedures on a smaller scale than what I had done work on my daughter and on many other people. So I would love to see surgery options come in sooner in the process. And to clarify, not all surgical procedures are the same. They vary in length of recovery, how intense they are, the amount of skin that's removed. So please don't be scared when you hear the word surgical procedure. The easiest surgical procedure and the one that I find that's most helpful are the deroofing procedures. So in those, they're great for abscesses that are recurrent, that come back in the same spot over and over and over, like fill, drain, or maybe it drains and it stays drained for a couple of days or weeks, and then all of a sudden it's full again. Those recurrent abscesses are the perfect candidates for deroofing procedures. And what they do is the physician typically will either cut the top of the abscess open or use a punch biopsy tool to do the same thing. They will then remove the top off of that and determine if there are tunnels coming from that abscess. They typically do that with like a blunt-ended instrument that they feel around the edge of the internal piece of that, looking for anything that feels different so that they can identify if there's a tunnel there. Because if they don't get the tunnel, then the recurrence rate is higher. So they scoop out all of the inside, basically. They remove the biofilm that is what keeps those abscesses coming back. I like to think of it as like a double-sided sticky tape for all of the bad stuff, all the bacteria and everything. Those are also, that biofilm is also inside tunnels. So that's what needs to be removed. So if the physician starts on one abscess and then finds that there may be tunneling, what they'll do is typically cut open where they find the tunnel to be. They will then go ahead and scrape the bottom of that and then kind of turn it into like what I would call a canyon. So it kind of has a valley in the middle and the bottom is the floor of that abscess that they have scraped clean. And the reason that they do that and they leave it open and make it a little bit wide is so that can heal from the inside out. When they do an incision and drainage procedure, which is an IND, and what they typically do at urgent care or ER visits, all they're doing is slicing that open, draining it, packing it, which doesn't need to be done for HS wounds, And then that skin grows together and closes before any of the, I like to call it bad juju, before any of that bad juju can come out. But when you do a deroofing procedure, it lets all of that bad inflammation and everything out, and it just heals from the bottom up, and it heals typically beautifully and in very little time.
Yeah.
So
they just look super scary at first when you're seeing somebody be healed from one or watching it be done. And even like the first time she explained it to me, I was like, Brinley, stop. I don't need to, you lost me at punch tool. Okay. What? Like, but honestly, it's like I sit here and I'm so proud of myself, honestly, because like I get the privilege and the honor to hear Brinley talk about HS so fluently, like the confidence behind her tone. Do you hear it? Do you hear it right now? She knows what she's talking about, people. And at first I was like, I don't know about this. I'm like, what? But the more I hear it, the more it becomes a part of your story. And I'm like, you resonate with the parts that she's talking about. I know many of you listening have had INDs and you wonder why they come back and you're wondering what a deroofing is or all of these things. And it's like, but the more you hear it, the more I will start talking more about it, it was like, the more you're like, this is okay. Like, this is just part of this process now. Like, this is what HS people go through and have to deal with. And it might suck sometimes, but like, I'm gonna make the best of it. And this is what I gotta do. So thank you for sharing that. Cause I know that there's so many people who live in fear about the thought and the word surgical or procedure or anything that involves a scalpel.
I keep telling myself, like, if my 17-year-old goes back for them over and over and over, they must work. Because there's no way that she would put herself through that if it didn't work. And with an incision and drainage, there is nearly 100% recurrence rate. 100%, which means that is coming back unequivocally. There is a much less recurrence rate when you do a deroofing procedure. Again, no guarantees ever with surgery with anything that happens in HS, but the recurrence rate is much lower with a deroofing procedure. And I don't have the actual stats because I'm not sure if any research has actually fully been done on it. I know that like in the surgical realm of HS, we don't have a ton of data yet about like what procedure is best, even the way that things heal. So I know that we're coming into that as it becomes more popular in HS. But definitely from, information coming from physicians who are obviously seeing these patients over and over, the recurrence rate is really low. I think Caitlin has had probably, I would say 25 or 30 deroofings. Is that, no?
I don't know, 20, they're going to be 15, 20.
Okay, so 15, 20. Yeah.
That's a lot.
And you've had recurrence one?
Yeah.
Yeah, once, I guess. So, I mean, that's a pretty good.
Yeah.
I'm considering that a success in my book.
It's better than the IND chances.
Yeah.
99% sounds crazy.
Yeah.
So as we wrap this up, I just have the question that a lot of people are thinking. How long are we supposed to be on treatment? Like, how long am I supposed to be on a biologic here? Say, now I know what my dermatologist told me, but I want to know it. I want to know what you think about that.
HS is a lifelong chronic condition. So if you're finding a treatment that works for you, you may be on it for the remainder of your life. So I think it's important when you are picking treatment to think about, is this something that's sustainable that I can do for the rest of my life? Life obviously changes, but there's, hopefully in the future, we will be able to phenotype and know what treatment is going to work best for you based on your HS, because there are different types of HS. But I think that for the most part, you can plan on having to be on some kind of treatment for your HS for the remainder of your life.
Yeah. Well, thank you so much for your honesty, and my dermatologist had the same
oh, thank God I passed.
It's like, let me find out. She's about to say I got half a life sentence.
Yeah.
You know what I mean? I was just like, well, I think that this was a very great episode, and it really is going to help so many people just get educated. I don't think we want to sway you any direction in your decision when it comes to treatment. It's your body, your choice, your responsibility. At the end of the day, we just want to give you the information that you need to be able to advocate for yourself best and make, a knowledgeable decision about yourself and your journey. So if you guys have any questions about treatment options, please put them down in the comment section below. I know we didn't touch the most common tale of time, but we'll talk about food in a different episode and how, you know, that can affect your HS as well. So thank you guys for tuning in, and thank you, Brinley, for answering some questions that they had for us. And until next time, guys, love you.